Hi guys, this is Mac and I welcome you all to my YouTube channel which is called Mac Vlogs. First of all, I would like to apologize. Due to some technical reasons, we have to restart this session all over again. So whoever has missed out, I am sure none of you have missed anything at all. So we are just starting fresh and new with our guest, Dr. Shahzad Shikoh, all the way from UK, and we're going to be talking about our topics. Good evening,
Thank you,
Dr.
Masroor, for
Shahzad. How
having
are
me.
you?
Thanks a lot. Thanks. It was wonderful to see you after a very long time.
Same
Of
here.
course, we go quite a long way back. We've had a lot of good, excellent childhood memories together. So,
I
yeah, so
those
thank you for
moments
having me.
definitely it was an honor to have you in my session today, basically because we have been a childhood friends for many, many, many years. So that's
Yes,
a great
indeed.
honor for me.
And I haven't
So
seen you in person in a long time as well.
yeah, same here. So
I
I'm
hope to
just
see you
excited
soon.
to see you and meet you soon once everything gets back to normal.
Inshallah,
Okay.
inshallah, inshallah.
So
Excellent.
everyone, this is Dr. Shahzad Shikoh. I'm sure a lot of people know him because he raised and grown up in Oman. So currently he's in UK and we're going to be talking about a topic, what is the recovery time for coronavirus disease and the other medical aspects which as a doctor's expertise we have over here. So please go ahead, Dr. Shahzad, and express and give your introduction and then we will proceed with a very enjoyable session of ours. Please go ahead.
Well, thank you, Masroor. Thank you for having me again. So, my name is Dr. Shahzad Shikoh. I'm a practicing rheumatologist and family physician in UK. I trained here and in both specialities, and I've been working there for more than a decade. So, I think Masroor wanted me to speak about COVID, just because obviously it's topical right now and something we all facing as a huge challenge right now. I think everybody knows a lot about COVID already in terms of how we manage, and we know there's no treatment for it until the vaccinations come up, which hopefully could be there end of this year or early next year. We hope. But in terms of just going through an outline again, how do we manage? Now we know COVID affects in a very mild to moderate way about 80 to 85% of patients. And so essentially that means that can be self-managed. So if in this current scenario, I know in Pakistan the numbers are going down, but still I would say anybody who's having any viral symptoms should be treated as COVID until proven otherwise. So I would probably first, in the first instance, I will try, to recommend like self isolation straight away. The second thing is not to panic. I think people do panic a lot. So not to panic, just self isolate yourself. As soon as you develop any mild symptoms like cough, cold, sore throat, headache, loss of sense of smell or taste, anything of that sort, you should just self isolate. Okay, and self isolation is minimum for 10 days. Is recommended.
Mhm.
And usually the principles of managing patients with suspected COVID or COVID with in mild to moderate category is essentially three. One thing is to focus on building up your immune system. The second thing is to reduce the viral load. I'll talk to you about it in a minute. And the third thing is essentially to help keep your lungs healthy. So there's certain exercise you can do and certain posture you can maintain during sleep, which would help your lung recover from this pretty sort of in a healthy manner. So the first focus, when I said should be on the immune system. So that is basically making sure you're having healthy, balanced diet. The second thing
Mhm.
is making sure you're having excellent 8 hours sleep. The third thing is you are well hydrated. Make sure you keep up with your fluids. And the fourth thing is supplements. A lot of talk about supplements. I'm sure Dr. WhatsApp has given you a lot of information about that. But general recommendation is vitamin C, which is a good immune booster, and it doesn't harm you even if you take it in sort of high doses. So 1 gram twice a day should be fine. Zinc, 20, 30 milligrams once a day is another good immune booster. And the third thing is vitamin D. Again, 1,000 international
Okay.
units a day should be fine. Usually, South Asian community are generally tend to be low in vitamin D, and it has quite good benefits on boosting immune system. So I would recommend these things in terms of improving immune system and just generally staying calm. Okay. The other thing I would recommend in Pakistan, where healthcare access to healthcare can be a bit challenging, would be to keep medical equipment called pulse oximeter. You may have heard about it, you may have not. It's a little equipment which is widely available, and I think it's relatively cheap as well, which helps monitor oxygen saturation, oxygen levels. And I think, as you know, in some cases, it can affect your lungs and cause pneumonia. So it will be a good way to reassure you and your family if you have this equipment and you get that checked twice a day while you're developing this, or you have these viral symptoms for the 2 weeks of the illness, and then the level should be more than 95 to 100% really. And if it's below 93% and you're feeling breathless, usually around day 7 or day 8, you must seek medical attention locally or see your doctor. Um, so that's the general outline. So coming back to my 3 points, principles in management is boosting your immune system. Second thing is to reduce the viral load. Now, how do you reduce the viral load? So when you're out and about and you're not able to maintain social distance, 2 meter, 1 meter, you need the masks on definitely to cover your nose and mouth. You know that this virus spreads through infected droplets from infected person, and it infects us through the mouth, nose, and your, in some cases, your eyes. So it's important to prevent or to stop that transmission. So make sure you're protecting yourself adequately. The second thing is rinsing, gargling will help. Rinsing your throat with salt and water, rinsing your nose. It's just because if you're exposed to COVID around you, then it just stops the transmission and helps reduce the viral load inside it, getting into your system really. So
Okay.
gargling your nose a couple of times a day, gargling throats, and also steam inhalation helps really just to reduce the viral load. So essentially, the principle is to try and reduce the viral load. Besides that, so first I mentioned boosting immune system, which includes 8 hour sleep and not to panic. I think often people take that for granted. And second thing I said, to reduce the viral load by doing these measures, steam inhalations, gargling, etc., and making sure you're wearing mask. And the third thing I would stress on is breathing. Breathing exercises are very important. So in small percentage of people, this can affect your lungs, and so regular breathing exercise, when when you're trying to breathe in, hold it for 5 seconds and exhale in a sort of relaxed manner. Probably do like 5 to 6 times a day, 3 to 5 sets, just to help your lung expand in an efficient manner, and it just helps your lungs keep them, to just keep it healthy and to cope with the infections.
I see.
Besides that, yeah, so they're breathing exercise. There's some other exercise people say you could try. Um, Sorry, excuse me. Yeah, you could try is blowing balloons. It may help, just because you're trying to blow out against resistance. Just helps expand your bases of the lungs, where the little airways, they can often collapse and collect fluid. So the whole idea is to keep your bases of your lungs, or just in general lungs, well expanded while you're recovering from this illness.
Okay.
So the whole idea is to keep your oxygen levels more than 95% on oxygen saturations. The equipment I've recommended, which will reassure you and keep you away from hospital if you're recovering well. So in terms of breathing,
Hey,
it's like you can. Yeah, sorry. Go ahead.
can I add one question here before you
Yeah.
proceed forward? That would be
Yeah.
like, as a doctor,
Yeah.
what SOPs are the doctors following to treat their COVID patients in the hospitals? Basically, because they are the most closer to the patients, right? So, what type of SOPs are the doctors following in the hospitals? What would
So
you
you
like to say
must
on
have
that?
heard about, yeah, thank you, Mr. You must have heard about personal protection equipment. So we've got an apron, an eye protector, and we've got FFP3 sort of sealed mask, which is not your standard surgical mask which you often wear.
Hmm.
And it's meant to, yeah, so in the high risk situations where we're dealing with patients directly who are infected with COVID, we have to wear a proper PPE, which is what the acronym is. So usually even PPE, they have categories. So there are low risk areas and high risk areas. So where in a hospital where the patients are not exclusively COVID, or they're just general medical patients with other illnesses, you can wear the
Mm-hmm.
standard PPE. But with like such areas where intensive cares, and where doctors are exclusively treating patients with COVID, you have to wear proper PPE, which is what our standard SOP is, in order to prevent the transmission of this virus,
Mm-hmm.
really. Mhm.
Okay. As a
So,
doc,
so
as a
I'll just completely, I'll just repeat
okay.
the self-management from the COVID point of view. So the 3 points mainly was the boosting your immune system. Okay, the second thing was essentially reducing the viral load, as I said, trying all those usual things you would do for any flu. Anyway, gargling, etc., steam inhalations, and third thing is breathing exercises, and of course this the medical equipment I've mentioned, Oximeter, to keep it at home, and that will help you reassure tremendously, I would say, in the 2 weeks of this viral illness, really. And I think that's about it. And just keep healthy, stay safe, and make sure you're wearing your masks, and make sure you maintain your social distance and avoid any crowded places. So that will be my outline for how you sort of cope with the current COVID. And don't panic, please. Just as you know, the
That
only
that is
the only point of panic or of cause of concern would be when your oxygen levels are below 93, or you're having some uh, breathing problems on day 7 or day 8 of the illness. That's when you need to seek urgent medical attention to see. And even then, it doesn't mean you need a ventilator. Let me clarify this. People panic in Pakistan. That may mean you may having another secondary bacterial infection. You may just need another antibiotics, or you just need a bit of oxygen therapy, which would be the case. So that's one thing I wanted to clarify. So yeah, guys, don't panic, and just take all the safety measures, and you should be fine,
okay.
inshallah. Okay.
Can you just little bit educate our my audience that how they should not be worrying too much and just take care of themselves basically because no one is understanding the seriousness of this particular virus. That's the reason people are just simply going out and losing their loved ones. So how much they should be following this, that is so important. Can you just tell them this
So
important
I think
message?
the only way I would say that in the last couple of weeks, I have had so many of my friends whose either their parents have been admitted in Pakistan. I'm saying they've been admitted in hospital, they've been on ventilators. Some of them have survived it through, some have not, unfortunately. So the bottom line is, COVID is a killer. We don't have any treatment. The only evidence we have is prevention by reducing, human to human contact, by keeping it minimum and wearing a mask, and that's the only way we can sort of reduce the transmission. So I think people don't realize how serious it is unless somebody in their family get affected, and that's very unfortunate. I think even in England, it took a while. What do I say about Pakistan? But yes, I think even we are now expecting a second wave. It's still important that if we are meeting people outside our household, we should maintain social distance. We should keep our mask on. As I said, the transmission is through the droplets, uh,
Mhm.
through our mouth, nose, and eyes. So you should keep that distance. If you can't wear those masks. Hand hygiene is very key. Keep up with your immune system. Don't panic. Make sure you're getting 8 hours excellent sleep. And that's about it. But yes, it is killing people. There's no doubt. We have lost 45,000 people there. You've got, I think in Pakistan, there are 3 or 4,000 people dead. America is another story altogether. So, there's no denying it's there. We don't have any treatment. And unfortunately, until people have their loved one lost, they're not understanding the gravity of the problem, really. But
I
yeah,
see.
yeah.
So as a doctor, you're treating all these patients every day. So other than the treating the COVID-19 patients, what is the other profession which is an expertise of yours, which would you
So
like to share?
I'm trained in rheumatology as well, and I guess a lot
Okay.
of people are not aware about the specialty. So essentially,
Mm-hmm.
it's a field which deal with the diseases of joints, bones, soft tissue like muscles, ligaments, tendons,
Right.
and it also deals with inflammation involving When I say soft tissue, it includes blood vessels. So, in other words, in medical terms, vasculitis. And essentially, most of these conditions are autoimmune. When I say autoimmune, what it means is your immune system is, and in some cases, in some patients, they run overdrive and they start attacking your own tissues, and they
Mm-hmm.
start damaging them. And that's where we come in as rheumatologists. We've got plenty of treatment for that. We've got plenty of medications which can treat that. A lot of misconception between us and orthopedics. People often get confused. So let me clarify, we are not surgeons. We deal with the diseases involving bones, ligaments, soft tissues, and joints. And the spectrum of the conditions we deal with is includes rheumatoid arthritis. You may have heard very rare conditions like lupus, gout,
Mm-hmm.
and other possibly serious conditions like vasculitis.
I see.
So we don't do surgery, but we've got plenty of medications to control these. The whole objective is to treat rheumatological conditions is to suppress or dampen the immune system. Dampen the inflammation involving your joints, your soft tissues, and in the process, stop the damage and prevent long-term disabilities. So
I
that's the
see.
whole sort of objective. And essentially, what we're dealing with is inflammation involving your joints, soft tissues, and your blood vessels. That's where we come in and treat these patients, stop damage to the joints, and prevent long-term disabilities.
I see.
Um, and we don't perform surgery as
Okay. Let me just add a question to this: Is
sure.
are you getting patients of these sort of patients are coming to you because of COVID-19? Everyone has been restricted to their homes. So how are the patients approaching you and they're coming to the hospitals? And are you allowing all
That's a
types of
very good
patients?
question, Masroor. Thank you for asking that. So
Yeah.
essentially, because of the COVID, you're absolutely right. People are scared to come to hospital. So because
Mm-hmm.
of that, a lot of people are sitting on cancer-like symptoms at home. There are a lot of urgent issues going on in patients, which is where they are not seeking urgent help, which is a
Mm-hmm.
big concern from our point of view.
Mm-hmm.
And obviously there are non-COVID illnesses out there. People won't stop having heart attacks or strokes, so they still need
Mm-hmm.
medical attention in the timely manner to prevent long-term disability and to improve morbidity and mortality. So in general, so yes, this is an issue. We are trying to educate the patient. I think because our first wave has gone, people are slightly more inclined to seek medical attention now. We have to keep pressing people. A lot of people are getting back in service now in terms of seeking medical attention. So yes, it has been a problem. It has been a concern, and I think because of that, we do feel there's a lot of delays in cancer diagnosis, and some other urgent issues involving other medical conditions. So yes, that is a concern.
So would you like to add on here by saying this, that the COVID tests which happening in your hospitals, are they free of cost or they're being charged for that? I don't know
No,
whether it's
because
happening
we work
around
for
the world.
NHS. It's all government funded, so it's all free
Okay.
for
Mm-hmm.
the whole general public as well. And I know in Pakistan, people are kindly like right now they are absolutely obsessed with getting tests done, even though they don't have symptoms, which is a bit ridiculous, I would say. I think
Mm-hmm.
so. I think on that note, I would like to say, please don't get tested unless your doctor recommends. There's no point. And these new antibody tests which has come up, they don't mean anything on its own. With regards to our test, the diagnostic test, we've got the PCR test, which is a gene test, and we often
Okay.
do two tests to confirm it. It is a swab test, and
Mm-hmm.
again, in some cases, it can be false negative as well. They said, I
Mm-hmm.
think the literature says about 30% of patients can still have a false negative result. So you may have viral symptoms, you may have a swab test negative, but it doesn't mean you still don't have COVID. Given the
Okay.
current prevalence in Pakistan, I would just treat as COVID, self isolate 10 days, and hopefully, if everything is okay, you've recovered. everything should be fine and you should be okay. But unless you, as I said, if you start dropping oxygen levels and you're having any breathing problems, you need to seek urgent medical attention. But yeah, the tests here are free. I think people back home should try not to do tests unless their local doctor advises. I think there's an issue if somebody in the houses in their house has got COVID, they somehow get tested. The other members get tested as well. There's no reason. I mean, if you've had a exposure to somebody who has COVID, which is
Hmm.
confirmed on swab test, all you need to do is, as long as you don't have any symptoms, you just need to self isolate for 2 weeks. The
I
reason
see.
being, if you don't have any symptoms, there's potential that you may develop those symptoms in those 2 weeks. So once you've passed the 2 weeks, you'll be fine. All that's all you have to do, and maintain the social distance with your family member. You don't need the test really, even but people would like to know, especially if you've got vulnerable people at home, like somebody who's got heart problem, lung problem, kidney problem, who's got other chronic illnesses which dampens their immune system, makes them more vulnerable to cat infection. If you're worried about that and you want yourself to get yourself tested, you can, but the main principle remains: need to maintain social distance with that person,
Hmm.
and do the basic things I've mentioned, three things. If you get any COVID-like symptoms. So yeah, that's it really. But yeah, I think I hope I've
You have
clarified few
covered.
things.
I think you have covered everything. That's so nice of you to explain in detail about the COVID-19 disease and what are the recovery aspects of it. So
The
definitely all the
recovery is Masroor, sorry, I didn't cover. So recovery time is maximum 2 weeks for mild to moderate. Usually 10 days self isolation is okay if you've got mild to moderate symptoms. For somebody who do not have any symptoms, and he had confirmed exposure to somebody who had COVID, then you must self isolate for 2 weeks,
I
just for the safe side. Because what we are trying to do is we are sort of preventing the transmission, or sort of reducing the transmission of this virus, which is a problem in Pakistan right now. All you need to do is self-isolate if you've got any consensus for 2 weeks.
Okay, this question is really important, basically for my
Mhm.
audience to know, which I'm putting across to you, is once the weather becomes a little chilly, like for example, when the winter comes closer, and we enter in October, November, December, January, when the weather is a little chilly. How is this COVID virus, I mean COVID-19 or the coronavirus, going to be different than what is now?
So from the literature evidence we have so far, it has no impact whatsoever on the weather.
Okay.
Obviously in Pakistan it's the summer time and people are still getting infected. So yeah, I think that's just a myth. Sorry. Yeah.
And what would you recommend everyone about the travel restrictions? So in terms, basically, because everybody is so used to traveling around the world, and at the moment the travel industry is hit really badly because of COVID-19. So how soon or sooner you see everyone traveling again and meeting their loved ones in different countries?
Yeah, so nobody knows the answer to this question. I'm looking for this answer as well.
I
Unfortunately, I think the safest thing, if you want to keep your family safe, I wouldn't think about traveling for a while. That's the
see.
sad reality right now, and I think we are all dying to meet our loved ones. But if you want to protect your family, your loved one, that's the only way. You have to stay where you are and just observe those standard SOP. And some people are speculating they may travel in December, but it's this is a pandemic. It's highly infectious
Mhm.
disease, and it's not easily controllable at the moment. The way things are going. So best way is to not travel. Until we know what's going on in the next 6 months. Yeah, I think that's my answer for you. Yeah,
Before we wrap up this
yeah.
session in a good way, can you just in the end let us know about the kids, age groups, and the youngsters and the adults, like over 50 plus people. So, who are most affected people and how they can control on their age wise? Basically, I have seen many people here in Pakistan and on TV that the adults are wearing the mask, but the kids are not wearing them. So, is it that the kids are not going to be getting affected easily,
So,
or
so the
is there
current
strong
data we
immune?
have so far, the data says that it doesn't affect kids, thankfully, fortunately, in any serious way. So that's a
Mm-hmm.
good news. But it doesn't mean that they're not carrying the virus.
Mm-hmm.
They still may be transmitting the virus from themselves to adults, but they don't themselves get affected. So that's a good news from the
Okay.
most of the data we have. I think in one or two cases we have had some, that they were badly affected, but I think in those cases as well they had some background medical illnesses which made them more prone to catching COVID
I
or
see.
having complications secondary to that. With
Mm-hmm.
adults, again, 17 above, 16 above, or anybody who's got any other medical illness, heart, lung, chest problems, diabetes, they are
Mm-hmm.
vulnerable. So they need to, make sure they do the standard, observe the standard SOPs. As I
I,
said, in the 15-20% people who do get affected, most of in that age group is above 70, especially from the data from Italy and yeah, China. Yeah.
any
So
food, any food or drinks which you would recommend to be avoided during this COVID-19 time, where you should not be eating those so that your immune system
I think, as I
doesn't get.
mentioned in my outline for the management for suspected or COVID patients, it's just about focusing on building up an immune system. The standard things you would do anywhere: balanced good diet. Uh, there's no specific juice or
But you
fluids. I
know,
would
right?
recommend
Everyone
make
is
sure you're
so
well
used to
hydrated.
eating
That's the key.
fast food.
That's the key. Well hydrated. Keep up with your hydration, and make sure you're taking a balanced diet. Regular fruits and vegetables, 5 portions a day. I've already mentioned about the vitamin C, D, and zinc. I know a lot of people are taking
I,
honey and kalonji. Yeah, I mean, if it works for them, fine. There's no harm in it. And so you can try all those things. Obviously, I don't have any herbal medicine experience, so I can only say that if it helps, why not? It doesn't harm you, so
you
it's
know,
okay.
why I asked that question was basically because, as you know, that nobody can avoid fast food and junk food so easily. You know, it's everyone eats those
I think
stuff.
that's my general advice as a doctor. Obviously, you should avoid junk food in general. It's not good for your immunity, for your general well-being. And obviously, once or twice as a cheat day, you can have it, but not should be. It shouldn't be a part of your routine, diet. Yeah. So
I
yeah, so
mean,
general things which you probably know anyway to help your immunity and just. I think that's the key to protect yourself. Yeah.
in the end, do you miss Oman?
Oh yes, definitely. I'm intending to visit Oman sometime in the next few years with the family, hopefully, and show them around where I lived for 17 years. I've got a lot of lovely memories. Yes, I would love to be there, and yes, I'd love to explore it again. And
Our
yeah,
journey of friendship started from Oman way back, long back.
yes, yes, definitely. Yes,
Yeah.
no, yes, we have had some lovely,
And the
wonderful
best
time
part
together.
is, our parents, our family, all are connected together every time they talk. They
Yes,
meet
alhamdulillah,
somewhere or the
alhamdulillah.
other. You know, so that's the wonderful part.
Alhamdulillah, we
Like
are blessed. We are blessed.
Alhamdulillah.
Yes. But yeah, no.
Alhamdulillah.
Once again, thank you for having me, uh,
It's a great
and I
pleasure
must
and
congratulate you. Sorry.
it was a great pleasure and honor to have you as my great guest as a doctor in my session today to cover all the bases which we were missing.
Thank you, Masroor. I hope it was of some use. It was pretty spontaneous, I know, but I just thought maybe I should just outline some of few things which may be still helpful to other
Thank you
people.
for thank you for adding the value today. Thank you so much.
Thank
It
you.
means a lot.
Thank you, Masroor, and look after yourself. And I must congratulate you. You are doing a lot of good work, and I wish you all the best.
Thank you so much.
And keep up the good work, and we are very proud of you. Okay,
Thank
thank
you.
you.
A small shout out for my channel. Would you like to tell all your followers to follow me and connect
Yes,
with
definitely.
my
I'll give them a big shout out that please follow Mac Vlog, and yes, I shall do that for you. No problem.
Thank you so much once again, Dr.
Take care.
Shahzad
Bye.
from UK.
Take
Thank
care.
you so
Bye.
much. Be
Cheers.
safe, be
Take care.
healthy.
Bye.
and keep
Yes,
smiling.
stay safe, stay healthy, and look after yourselves. Okay, love this.
Allah
Love
Hafiz.
this.
Thank
Love this.
you.